First, let's start at the beginning. What is GHLF? When did it start? What does it do?
Sure. So GHLF, Global Healthy Living Foundation, is a nonprofit that we started nearly 20 years ago. I've actually had arthritis since I was 13 years old. And when I was a freshman in college, it was the middle of the night, literally third week of school. I was miserable. I was lonely. I got out of bed. I emailed my former internship boss, and in one sentence said, there's got to be a way to bring people together in a positive environment where we could share strength and experience. And his name is Lou Tharth. And when he woke up in the following day, he emailed back, I'd like to become a social entrepreneur. How about we do this together? And that afternoon, we created what's called creakyjoints.org, which is our online patient community for people with arthritis. And then a short while after that, we incorporated the official nonprofit Global Healthy Living Foundation as the umbrella nonprofit of Creaky Joints.
Seth, first of all, tell me, you're a New Yorker originally. Where were you in school?
I was up at Babson College in Waltham, Massachusetts. Yeah.
Oh, sure,
and,
absolutely.
It's just one of those things where, I'd grown up as a teenager with arthritis, and I was an advocate for access to care as a teenager. And when I went away to school, I was very isolated, so I wanted to, bring people together and create community using this new thing. In the 90s, the internet was brand new. And, when I got together with Lou, he's somewhat older, basically a boomer and a millennial, have been doing this ever since for the last 20 years. And I'm very proud that today, Creaky Joints and Global Healthy Living Foundation, GHLF, reach millions of people, not just with arthritis, but all forms of chronic conditions, with the mission to improve access to care and to ultimately help people live the best life they can despite the conditions that they might have.
This is a coincidence, Seth, but one of the hats I wear is as president of the Richard Nixon Foundation. I oversee the foundation in Yorba Linda, California, from the East Coast. And we are preparing to celebrate the 50th anniversary of the launch of the War on Cancer, which President Nixon began in December of 1971. It was really the first public-based initiative to challenge a disease. And in the 50 intervening years, there have become there have come into being a number of groups that have umbrella missions to support groups, but I've never seen an umbrella for the umbrellas, which is what the Global Healthy Living Foundation appears to me to be. Is that a correct assessment?
That is, and that's really because of the forces of nature at work. There's no way to just focus our energy entirely on one condition for two reasons. One, most people don't have one condition. Everyone has something else, and it's called comorbidities. And two, our efforts, which are virtually all digital and mobile and web-based, really can apply across the board to many different chronic conditions. And we've seen that really accelerated and articulated in unmet needs with respect to, the most recent situation around coronavirus and COVID-19, which is why about a month ago, GHLF, did a hard pivot toward coronavirus support specific to the chronic disease patient community, disease agnostic, and regardless of the condition that you have. Of course, beginning with those high-risk populations, people that have existing conditions that put them at increased risk of infection and complications from COVID-19. We've all heard about these now in the media. And to your point, cancer is one of those big groups or people recovering from cancer, taking medication for it, immune-compromised patients, autoimmune patients, of course, COPD, asthma, patients with pulmonary conditions, diabetics, type 1, type 2 diabetics, as well as HIV/AIDS. The list does go on and on. We've got about a dozen core conditions that we began our support activities with, and from there we've been adding daily information and support for all of the other additional chronic conditions that put people at high risk for complications from COVID-19.
I'm talking with Seth Ginsberg, co-founder of the Global Healthy Living Foundation, which you can access at ghlf.org. Seth, Dr. Birx, who's become well-known to most Americans who have a television, spent a lot of her time recently discussing comorbidity and why COVID is taking such a toll on two particular communities, the African American community and the Native American community. And she cited underlying long-term diseases which are more common in those communities than other. It's not that COVID has a greater attack rate, to use her term, on any particular minority. It just has a greater attack rate on people who have these comorbidities. And as I look at ghlf.org, I see a lot of comorbidities which are obviously in the target zone for COVID.
Yeah, unfortunately. It's almost as if, ironically, we've been preparing for this for the last 20 years. And starting in early February, around there, around the time U.S. Health and Human Service Secretary Alex Azar declared a public health emergency around coronavirus, we were, basically digital first responders for these various communities. GHLF spends a lot of time and energy and resources also meeting unmet needs around disparities in care and underserved populations, African American as well as Hispanic communities. All of the things we're talking about here are available in Spanish language as well, of course, to reach the widest possible audience. But unfortunately, to your point, Hugh, these are folks who, had struggles going into this, and their vulnerabilities and their susceptibilities amplify their anxiety. They're very rightfully, they have fear, rightfully so. And unfortunately, there really aren't too many places to turn that speak to their specific conditions vis-a-vis the coronavirus. And that's really the gap ghlf.org is filling. We have a very simple enrollment process for a support program that's totally free, that we invite patients as well as their families, who are very much a part of this as well, to participate, to join the organization, to receive regular updates and information related to their condition, support and community, because we are really all in this together, and we want to foster that community and galvanize that community. And then participate in community advocacy and getting active locally to help each other and to keep one another safe. And then finally, and most recently, to participate in research, because as you know, Hugh, we need a lot more information about this. There's a lot of data lacking around coronavirus and COVID-19 specifically. And GHLF has a bona fide research department for the last 6 years. We've published something like 50 papers and worked with about 24 different academic research centers around patient-centered research, patient-reported outcomes research. And we've been working with researchers from around the world to very quickly and efficiently create what's called a registry, which enables people who have autoimmune conditions and related comorbidities to participate in research to help researchers understand kind of the implications, the impact, the situation as it relates to COVID-19. So there are a lot of things in it for the patient, if you will, and that's, again, something that we're very proud of because we've been kind of training and organizing this for a long time, not realizing the emergency nature of our activities and services that we could then be providing. And our GHLF patient support program is free and available to people with chronic conditions and their families.
And that's where I want to send people right now, over to GHLF, right? Global Healthy Living Foundation. The website is ghlf.org. When you go there, as I am looking at my computer right now, you will see a variety of conditions subgroup: heart disease, migraine, HIV/AIDS, rheumatoid arthritis, some that I can't pronounce, but sickle cell anemia, I can, Crohn's disease, lupus. All of these people, all of these conditions have subgroup leaders within the Global Healthy Living Foundation. And what do people do, Seth, when they get there and you say, join? What are they joining? There's a high level of resistance to joining anything about which there is any degree of non-knowledge. So what are they joining?
Yeah, great question. And even before we get there, and thanks for highlighting this, I'd be remiss if I didn't mention we very quickly and efficiently created our COVID-19 Patient Leadership Council, who are patient advocates living with the diseases that you talked about, you mentioned it, and several others. And these were the folks who have really come out front and were spearheading awareness around at-risk populations at the beginning of the pandemic. And with their involvement, we were able to develop very personalized information and support for these various conditions that these patient advocates, our Patient Leadership Council, oversee. So when someone goes to ghlf.org, obviously, they're presented with this program, as you mentioned, and it takes about 2 minutes, very quick and very confidential, of course, form that folks can fill out. And soon after that, the support program emails, and shortly coming after that, text messages, if people want, will be sent to the customized needs and conditions based on the user profile. There isn't a one-size-fits-all approach to coronavirus support, and so our aim is to make this as personalized as possible, which is the reason we have a very simple registration form for folks. And we encourage anyone with a chronic condition, or if they're supporting a loved one or a family member with one, to join and be a part of our community. And the last point I want to make to you, because I think it's an important one, is we're very privileged and have had the opportunity to operate GHLF as a privately held foundation. We will never ask for donations. This is not some backdoor for fundraising or anything like that. We never sell private information. We always keep patients at the center of everything we do. And we have joined with and partner all the time with kind of more traditional disease advocacy organizations, and we're very happy to promote their fundraisers and their activities. But I just want to make sure your listeners understand that GHLF is here as a service to community, as a service to nation, red state, blue state, purple state, East Coast, West Coast, Midwest. It really, this situation we're facing right now cuts across it all, and I'm very proud that GHLF is serving as the institutional support program and organization for all Americans living with chronic conditions, and millions of patients have already engaged with us in the very short time that we've put this together. And with your help and that of your audience, we're able to continue to mobilize and galvanize and support people through this process, because this will pass. This too shall pass, as they say. And when it does, and we pray every day it does quickly, we want to be a little better off at the other side of it. And that's the goal, and that's the mission of GHLF.
So my recommendation, if you're listening to this, is to visit ghlf.org. And the very first thing to do is, it says learn more about GHLF. All right, go learn more about GHLF. You will be impressed, as I was. I don't do this very often. You know that. You've been listening to me for 20 years on this show. I do not do this very often. I have to be persuaded of the efficacy and the sincerity of the people in the not-for-profit sector when they do this sort of thing. And I am persuaded that Seth and Lou are onto something here, which is, in a time of isolation, connect with people who can empathize with your particular condition. And Seth, I want to give you a last word. Are you on the arc that you expected it to be? Is it reaching the people you need to reach?
It absolutely is, Hugh. It's overwhelming. It's inspiring. It's a little terrifying. But like I said, we are the digital first responders and have been tenderly and socially distancing, holding the hands and hugging patients who are at risk, who are vulnerable, and their families, because we will get through this together. And we're proud to offer this support program to the public, to our community, and to enable us to get through this successfully. So I thank you for your conversation here, and for alerting your listeners to this service that's available. And again, I would encourage everyone to check out ghlf.org. Of course, we've got lots of social media activity, and we're not hard to find online. I'll say that. But we've got a lot to offer for folks that enroll, and I look forward to getting out to the other side of this and following up and letting you know of our successes and letting you know how much stronger and better off we are on the other side of it.
And please let us know about little Ginsberg, and prayers for your entire family, especially for the baby. And ghlf.org is where you go. Go there and be well, Seth.